All right, welcome, Betty. This is the Betty interview, right?
Yeah,
We have Betty Flores with us today. Thank you so much for joining us on the Spotlight series of the best in Utah Pelvic Health. And I'm excited to jump in and chat all things with you. And so I'm just going to read your bio here for everyone listening, and then we'll get into the questions.
awesome. Thanks for having me.
Yeah. So Betty Flores is a licensed clinical social worker and a certified perinatal mental health specialist with extensive experience in supporting individuals through the emotional challenges of pregnancy, postpartum, and reproductive health. She is EMDR certified and currently pursuing certification in ERP exposure and response prevention, enhancing her abilities to address anxiety and trauma-related disorders. Specializing in the treatment of perinatal mood and anxiety disorders, Betty works with the individuals facing complex issues such as postpartum depression, OCD, birth trauma, reproductive trauma, and infertility. Her therapeutic approach is client-centered and strength-based, empowering clients to find relief and healing from attachment wounds, childhood trauma, and the unique stresses of parenthood. Betty's dedicated to creating a safe and non-judgmental space where her clients can process their experiences and regain control over their emotional well-being. She is passionate about helping others build resilience and thrive during some of life's most challenging transitions. Awesome. Well, I'm so excited that you're here. And the first question we're going to jump in right off the bat is what made you decide to be a mental health therapist in general?
Yeah, so my parents actually are both in the healthcare field. My mom has a nursing background, and my dad has a counseling background along with a couple other things. But so always having them around and kind of modeling, helping and being in that space. But honestly, I think it was undergrad, and it was like the last semester of undergrad. I'm like, I don't know what I'm doing in school. And so I took a bunch of like just random courses. And I think it was social work 1010. And I had to do like so many hours of community service. And I did it at the Christmas Box House out in Ogden. And I just loved being in that space of supporting others. And yeah.
Yeah, amazing, amazing. Okay. What would you say makes you different in your approach?
Um, makes me different. Well, I think my niche is very specific, right? It's perinatal focus, but also like I've even niched down more of being really EMDR and ERP focused. So really those are the only clients that I'm taking at this point,
Mhm.
of like, yeah, really wanting to focus on those things, really wanting to um, create that name for myself, I guess, as being the EMDR and
Yeah.
ERP specialist in the perinatal world.
And then can you, for those who don't know what EMDR and EPR, can you explain that a little bit of like, what is that? And like, and that would lead into our next question of like, who's an ideal fit for like that type of role to get that
Yeah,
therapy?
yeah, for sure. So I think both modalities really do a lot of shifting in the brain and thought processes. But eye movement, desensitization, reprocessing, or EMDR is a lot of trauma based, depression. So pregnancy, infant loss, infertility, birth trauma, reproductive trauma would be good fits for that. And they use bilateral stimulation. So either some people will be like, is that when you follow the ball across the screen? I'm like, yeah, that's one way to do it, or they have tappers too to really help um, shift those thoughts in regards to the experience that you had to either a more neutral one or a positive one.
Mhm, mhm,
Yeah. And then ERP or exposure response prevention is more for OCD anxious clients.
mhm.
Um, and and basically you're really exposing yourself to the fears that you have, and teaching your brain that they're not that scary. They're not as scary as your brain is making them, and that you can like withstand the fear
Mhm.
that it's creating. So
Super cool. Awesome.
yeah.
What does the process look like to work with you then?
So people either find me through my website, text me, on my Instagram. So really any of those places is a good way to contact me.
Mhm.
Um, and once you reach out to me, I feel like I'm pretty quick. I try to respond, within the hour if I can, if I'm not in between clients, whether that's a text or call, to set up a consultation to see if we're a good fit.
Mhm.
Um, whether, you know, clients are in network or out of network with me, if they feel like we vibe or, you know, have the same kind of energy, they want virtual or in person, all of those kind of things are explored. And if ultimately at the end, it's not deemed a good fit for whatever reason, I do my very best to connect them with somebody that is.
Yeah. Yeah. Awesome. Okay. What does recovery look like from like pregnancy, postpartum, that transition that, you know, from your lens? Like, what is that?
Like, what do I see in my clients? Is that what
Yeah,
you mean, or just?
yeah, what do you walk your clients through in that recovery period or that transition?
Yeah, so a lot of the times, I mean, first it's like the initial assessment, really trying to see which modality is going to work best for them, right? If it's any anxiety type, I really try and steer more ERP. And then if it's, you know, the other ones that I had mentioned with the trauma or depression, I really do EMDR. And the nice thing about those modalities too, it's like very structured and there's like a light at the end of the tunnel, right? So it's not like this endless talk therapy. And I've seen great success in it. And so that's kind of the cool thing is like they get kind of like in pelvic floor, right? Like you get them getting into these exercises or getting to shift their brain in certain ways, really challenge some of those patterns that have been there or have been created since birth. And then they can do a lot of the work on their own, but really being able to see the shift in those brain pathways and them not being so distressed with the events that were distressing when they came in. So I would say I probably see people 6 months, you know, maybe max a year. But again, it's pretty structured. And if people are putting in the work, then like you can see the results pretty clearly.
Yeah, amazing, amazing. Okay. What's something that most people don't know that you think that they should know, whether that's about your practice, about therapy, about pregnancy, postpartum, like what's something around that?
Yeah, I mean, one, I think that, you know, the likelihood is 25%, you know, to have a perinatal mood or anxiety disorder. So it's really not that uncommon. People just think it is. One, if you've had any sort of mood or anxiety disorder or family history of that too, you're more prone to have one. So really just some of the signs and symptoms that could be preventative, or at least you could be aware of, right? A lot of what's normalized isn't normalized normal, it's just common. And a lot of people will be like, yeah, we'll be like, oh no, that's normal. It's like, well, it's not, it's common, but it's not normal, you know. And like, let's get you thriving instead of just surviving.
Yeah. Awesome. Awesome. Okay. Is there anything special that you want to promote to the audience listening here? It can be anything at all.
I think this, I would say I'm already MDR certified. So like really any ERP, if you're worried about, you know, intrusive thoughts, scary thoughts, that's really what I'm trying to delve into. I think the most right now, I'm feeling really confident in both modalities, but with finishing up my certification, like if that's anything that you're interested in exploring or want support with, like please come my way. I'm so happy to be able to support in that area.
Awesome. Awesome. Okay. My last question, but favorite question to ask is, what's the main thing that you want to be known for?
I think I answered this a little bit, but I think just being, again, EMDR, the EMDR or ERP kind of niche and perinatal, right? So any of those like really scary thoughts that some parents don't want to talk about, right? Like dropping my baby, hitting my baby, whatever, you know, drowning my baby, like all of those things can be scary, and it's different than psychosis, right? And so like being able to have the space of being really vulnerable with some of those scary thoughts and deciphering like, hey, is this anxiety or is this something else? And like if it is anxiety, you know, OCD, like there is treatment for it, and like let's get you the right treatment, because those other modalities are just going to exacerbate the issue.
Totally, totally. Well, thank you so much for sharing that. Where can we find you? What's your website? Where's your social media? All things like that.
Yeah, so my website is Perinatal Wellness. Will you be linking the things as well?
Maybe. Yeah.
Okay. Okay. I was like Perinatal Wellness, and that's also my Instagram handle as well. But it should, if you search Perinatal Wellness or Betty Flores, LCSW, my website's linked right on my bio as well. So
amazing.
yeah.
Amazing. Well, thank you so much for jumping on here and highlighting all the things that you're doing in our community. And we're so thankful to have you. We'll see you soon.
Yeah, thank you so much. Bye.